Hey guys, welcome to my channel. I want to make a statement. If you've not watched this video or you're yet to see this video and you're about saying yes to a marriage proposal, or you have someone who is about saying yes to a marriage proposal without watching this video, just do me a favor. Pause, go and meet the person. Tell the person, please watch this video. After watching this video, you can go ahead with whatever you want to. Or if somebody is kneeling down in front of you with a ring, hey, my dear, watch this video first before you say yes to that proposal, because it's going to help you to avoid stories that touches the heart. Hey guys, welcome to my channel. I'm Dr. Jenny, a medical doctor living and practicing here in Nigeria. Today we'll be talking about medical tests to do before saying yes to a marriage proposal. First we'll be discussing today is genotype. Genotype is just the genetic makeup of an individual. Why is it necessary to know your genotype before going into marriage? Reason: to avoid giving birth to children who will suffer you, make you stay in the hospital, on and off the hospital, because when in a month you spend 3 weeks in the hospital, then the remaining 1 week at home, is not a funny thing. So I don't think it's something you would like to endanger yourself to. Let's take for example your AS and you have a partner who is AS. What are both of you doing now? Because tomorrow you will be the one to regret it, no matter the level of love, no matter what the person is telling you. Oh, I love you, I do this. Let me tell you, when that challenges comes, you're not even going to remember all those butterfly, all those early things you were promising yourselves. Yes, it happens. You know, having to stay back in the hospital and going to this hospital, you don't go to hospital without money. Do you understand? Even the cost of training a child that is a sickler, you have to keep going to the hospital. You're doing a lot of tests, you're doing exchange blood transfusions, plenty things are involved in it. And let me tell you the truth, let it not come to a time where you're looking at the doctor is wicked, don't you know I have a sickler? My dear, you had all the time in this world to make that decision. And don't make it look like it's another person that made that decision for you. So please, I'm begging you in the name of the Lord, if you have somebody, you have a partner, your SS, your partner is AS, you should not do anything. You don't have any business with that person. Or your AS, your partner is AS, you don't have any business with that person. Or your AS, your partner is SC, you don't have any business with that person. You know, CC, SC, AC, those ones are rare. They are not that common. I know the regular one we all hear about is AA, AS or SS. Yes, we have those ones. So if you're AA, then you're free to marry any of this SS, AS, AC, SC. You're free to get married to the person. But please, if you are SC, please don't make that mistake of going to go and marry somebody that is AS. I don't know if we are really understanding all these things, because it will help you. I think I'm going to do a topic on genotype to discuss everything about it. But for the sake of this topic today, we are not just taking it as one. We are discussing medical tests you should do before saying yes to a marriage proposal. The second in the list is blood group. Blood group, why is it important? It's very important for every living person. You're either A, B, or O. Then for everybody who is A, B, or O, you're either rhesus positive or rhesus negative. It's same as everybody, whether you're O, whether you're B, whether you are either positive for rhesus or negative for it. And what is this rhesus factor? It's a protein and an antigen. Is seen on the red cell of those that is positive in their body, but if it's negative in your body, you don't have it. So why are we talking about this today? Yes, we are talking about it because if you're a woman, you're rhesus negative, then you go ahead to go and marry a man who is rhesus positive. You can get married, quite all right, don't misunderstand me, but as you're getting married to the person, you have to be informed first to know the chances of what you're going to miss in the marriage. For example, If you're negative and your husband is positive, when you have your first child, that's the very first child, something will happen. Once you're pregnant and the baby in the womb is positive, your body, because through the placenta, that's where the baby is feeding and everything, then the baby's red cells will seep into the mother through the placenta. And when the immune system of the mother sees this, it sees it as, wow, we have something strange. It sees it as a foreign substance. And what does this thing do? The immunity of that woman will build antibodies against the antigen, which is the rhesus positive in that baby, thinking that is helping you to prevent a lot of things, but it doesn't know it's harming you. Do you understand? You don't have, it's not something you are to negotiate. The body is just taking care of all those things, thereby destroying the red cells of this little child, causing hemolysis for this child in utero. That's when the child is still in the womb. And what happens after then? When this red blood cell has been broken down, there's a lot of bilirubin in that child. And if there's a lot of bilirubin in that child, the child will be born with jaundice. And if it's so severe, the child can even die of it. That's if not treated properly. So I don't think it's something you would want to endanger yourself with. But there's a solution. Yes, for every problem, there's a solution. What's the solution now? The solution is that if you're pregnant and you already know you're negative and you have a positive husband, you will go ahead, go for antenatal. This is not a time to stay back at home and decide, oh, I don't like going to the hospital. It's very, very important, because when you go to the hospital, you will be told to take a vaccine. A Rogan vaccine is an anti-D vaccine. When you take this vaccine, what does this vaccine do? This vaccine helps to mop up those antibodies that your body has created, so that in subsequent pregnancies, it will no longer recognize, it will just be seeing it as a fresh thing. But when you allow these antibodies, if they are already in your system, what will your body do? They already know, oh, we've seen that our enemy again, they will fight. But when you have this vaccine, this Rogan vaccine, it will just go and mop up all those antibodies. It's being given in second trimester and within 72 hours after delivery. So this Rogan vaccine is very, very, very important. So if you've had a miscarriage or you aborted a child, probably you're a negative woman and you aborted a child before in the past, you're going to have a problem, because you may not be able to carry any child that is rhesus positive. But if the child is negative, you're negative, no problem. Everybody will just enjoy him or herself. Do you understand? But when you people are incompatible, that's what we call rhesus incompatibility. When you people are incompatible, then the baby will not stay. Because after that subsequent pregnancy, there will be plenty miscarriages, and this woman won't be able to carry another baby. That's why you see the person just had the first one. Anyway, the first child is always free from all this, because it's the first. That's when the body was still trying to know what's happening. But other pregnancies, there's always trouble. The third we'll be talking about is sexually transmitted infections. Sexually transmitted infections like HIV. When one partner is positive for HIV, it is not a reason to quit that relationship. Yes, I said it. You can have children who are HIV negative, yes. And when the partner, the one that is positive for HIV, starts medications, antiretroviral drugs, it will drastically drop the viral load. Then he or she won't be able to transmit to the partner. So you can live all your life as a partner without having HIV. Yes, I said it. So please, but if your faith cannot carry you, my dear, don't go into it. Or tomorrow you will run out, hey, is it because I accepted you with HIV? No, it's something when you love someone and you feel you don't want to leave the person. I'm just telling you that is not a reason to leave a marriage proposal. Then I'll also be talking about hepatitis B, C. For hepatitis C, there's no vaccine yet. But hepatitis B, there's vaccine for it. So you can get vaccinated for it. And you can have children who are negative of hepatitis. Then we'll also be talking about syphilis, gonorrhea. Those ones can be treated with antibiotics. So once you find it out in your partner, just go ahead and treat with antibiotics. So the fourth we'll be talking about is chronic medical conditions. Chronic medical conditions like diabetes, hypertension, seizure disorder, asthma. When you notice you have any of these, you just discuss it with your partner. There's no need trying not to talk about it. It's good to talk about it when you're asthmatic. It's good to talk about it so that in case when you're having crisis, your partner will know, oh, just get the inhaler. And even when you try forgetting it, oh, just try to put your inhaler in your bag and all that. It is also a way of helping you, even in medications. When your partner is constantly reminding you, oh, take your drugs. Have you taken your drugs today? It's a very good one. So, and also even in diets, if you're hypertensive, if you're diabetic, there are so many special diets. Your partner will also help you. So it's very, very important to discuss your chronic medical conditions. The fifth we'll be talking about is mental health assessment. When you're talking with someone, don't just go carried away by buy shawarma, buy ice cream, buy this, buy. No, it's a time to sit down, and when you are talking, you're trying to reason things out and all that, because even on your own you can be able to figure out some. Then when you feel, oh, you need a medical person to come in, then you can go to the hospital. And when you notice maybe your partner is having mood swings, going through depression, anxiety disorder, post-traumatic stress disorders and all that, then you can seek for a psychotherapist, then book sections for the person. And most times after the section, the person becomes so fine. It's a way of also helping the person if you may not be able to handle it. But it's good to know, because even when you have a partner who is always having mood swings and everything, once you know about it, it will no longer irritate you. But you can imagine when you don't know about it and all of a sudden the person is just showing up things you don't like, you will get so tired of the person. So it's good to know about all those things before saying yes to a marriage proposal. Then if you have a partner who has schizophrenia, mania, those ones can be treated. Then you go to the hospital. Maybe the person starts seeing a psychiatrist and receives medication. Then another thing you will do for that person, most of those medications actually causes weight gain. You also encourage the person to continue taking medication so that the person will not break down. Do you understand? I think it's a way of also helping when you know about what your partner is suffering from. We'll be talking about the last one, which is fertility test. This is not compulsory. Yes, I said it is not compulsory, especially for those who don't want to have biological children. Some people might just want to maybe adopt one or two. They don't mind. Yeah, if you have a partner like that, then there's no need for fertility test. But if you don't, it's necessary. You can go for it, especially when you don't even trust the person. But why would you marry someone you don't trust? But I'm just saying it that is necessary. You can just do it. It's not a must, but you can do it. When you go for fertility test, you can do a few non-invasive ones like pelvic scan, hormonal assay for the female. For the male, you can do a seminal fluid analysis. Just those few would actually say a lot about the partners. Then it's now you will be the one to know, oh, do I want to continue with this? Maybe there's something you found out, or do I quit? When you have done all this medical test, at least you can hit your chest to say, I can go on with this marriage. Even when you found out something about your partner, just like I told you, most of them, there are no reasons to quit. Do you understand? It's just that you are informed about it. And when you know about something, then it won't be strange. Maybe in the marriage you're seeing something you don't like. Oh, because of at least you already know about it. I want to say something. If you have a partner who probably has a medical lab or something, a private medical lab, and maybe he said, oh, come to my own lab, please, I'm just telling you, for the sake of the future and tomorrow, please go to a tertiary institution for this medical test. or you can also go to a missionary hospital or a private hospital you trust. Don't just access it anywhere, because I've heard people, a lot of that, doctor, when we did this test, I was told I was AA, my partner was AS, so what's happening? How come I have children who are SS? Then probably there was a mistake, or maybe anything happened. Me too, I can't even answer that question. When I've heard a lot of people tell me, so but I cannot answer that question myself, because I wouldn't say what happened exactly. Then again, some men, when probably they had trained a lady in school, they paid their school fees for 6 years, they sponsored you, depending on the course anyway, 4 years, 5 years, the number of years you spent in school, and at the end of the day, someone is coming to tell you how you can't marry the person because she's AS, you're AS. Most of them might go ahead. When you're hot, you're always looking for a way to just go through it. Most of them might just go to someone, pay, oh, can you just give me a wrong result? All because they feel they have spent so much, they can start again with another girl. But it's not a reason to stick with someone when you're AS and your partner is AS. So with these few tests, then you'll be able to stick out your neck and say yes or no to a proposal. And whatever comes out of it, you'll be able to handle it because you agreed to it together. It should be a mutual understanding. Thank you so much. Then if I want to make a statement too, if this is the first time you are seeing this face and this is the first time you're hearing me, just do me that favor. Subscribe to this channel so that you'll be part of what we are doing in this channel, because it promises to be wonderful. We will yet be discussing many health issues here in this channel, so just subscribe to be part of this family, Dr. Jenny's family, and you will really, 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 really love what we're doing here in this channel, and you won't regret stopping by to subscribe. And also, whenever we put up a video, you will actually be among the first to know about it. Thank you. See you in my next video.